The rotator cuff or the musculotendinous cuff of the shoulder. It is a fibrous sheath formed by the four flattened tendons which blend with the capsule of the shoulder joint and strengthen it. Embryology. Mesoderm gives rise to the muscles and ligaments in the body. The muscles which form the cuff arise from the scapula and are inserted into the lesser and greater tubercles of the humerus. The muscles are remembered by a mnemonic, SITS. Remember to put small t. It denotes that it is teres minor, small, minor. The S denotes supraspinatus muscle and the I denotes infraspinatus muscle and T denotes teres minor and the S denotes subscapularis muscle. The tendons, while crossing the shoulder joint, become flattened and blend with each other on one hand and with the capsule of the joint on the other hand before reaching their points of insertion. The cuff gives strength to the capsule of the shoulder joint all around except inferiorly. This is why the dislocations of the humerus occur most commonly in the downward direction. The function of the rotator cuff muscles is to grasp the relatively large head of the humerus and hold it against the smaller, shallow glenoid cavity. It stabilizes and centers the humeral head in the joint socket, that is, the glenoid cavity. Blood supply and lymphatics. The vascular supply to the rotator cuff muscles is mainly via the suprascapular artery, which is a branch of the subclavian artery, the subscapular artery, which is a branch of the axillary artery, and the posterior circumflex humeral artery, which is a branch of the axillary artery. The suprascapular artery supplies the supraspinatus and infraspinatus muscles. The subscapular artery supplies subscapularis muscles, and the posterior circumflex humeral artery supplies the teres minor muscle. Nerve supply. The subscapular nerve, upper and lower branches, innervates the subscapularis muscle. It originates from the posterior cord of the brachial plexus. Its root value is C5, 6, and 7. The suprascapular nerve innervates the infraspinatus and supraspinatus muscles. It originates from the superior trunk of the brachial plexus, passes through the suprascapular foramen. As we have already studied that the navi flows below the bridge, that is, the suprascapular nerve lies below the suprascapular ligament, while the artery is above the ligament. Its root value is C5 and C6. Axillary nerve. The axillary nerve innervates the teres minor muscle. It originates from the posterior cord of the brachial plexus and it passes through the quadrangular space into the posterior scapular region. Clinical anatomy. When we look at the pathologies of the rotator cuff muscles, we need to differentiate between the degenerative and traumatic lesions. An example of a degenerative disease of the rotator cuff is the subacromial impingement syndrome. There, the supraspinatus muscle tendon gets impinged at the acromion, that is, it gets hit or compressed at the acromion. This process is commonly caused by a thickened tendon or an inflammation of the overlying bursa, that is the bursitis, thus compressing the subacromial space. Another possible cause for an impingement is a bony subacromial spur resulting in narrowing of the nerve with pain. A positive near sign when elevating the shoulder above 120 degrees is characteristic of the impingement syndrome. The rotator cuff tear is an example of traumatic lesion of the rotator cuff, where it comes to a rupture of one or more tendons up to the point of a complete tear of the rotator cuff muscles. Often those ruptures have been preceded by degenerative changes in the rotator cuff. The treatment can be either of conservative or surgical nature, transosseous fixation, depending on the severity of the rupture and the patient's age. Even though the rotator cuff consists of only 4 muscles, it plays an essential role in the stability and mobility of the most flexible joint in the human body, that is the shoulder joint. Let us discuss some important points about the muscles involved. First, supraspinatus muscle. Its origin is from supraspinatus fossa of the scapula. It inserts into the greater tubercle of humerus. Its innervation is by suprascapular nerve, and its function is initiation of abduction of arm to 15 degrees at glenohumeral joint and stabilization of humeral head in glenar cavity. Second, infraspinatus muscle. Its origin is from infraspinatus fossa of scapula. It inserts into the same greater tubercle of humerus. Its innervation is by the same suprascapular nerve. Its function is external rotation of arm at glenohumeral joint and stabilization of the humeral head in glenar cavity. As we know, every muscle in rotator cuff helps in stabilization of humeral head. Third, teres minor muscle. Its origin is from lateral border of scapula. It inserts into the greater tubercle of humerus. Its innervation is by axillary nerve. Its function is external rotation and adduction of arm at glenohumeral joint and the same stabilization. Fourth, subscapularis muscle. Its origin is from medial 2/3 of subscapular fossa. It inserts into the lesser tubercle of humerus. Its innervation is by upper and lower subscapular nerves. Subscapularis muscle. Its function is internal rotation of arm and stabilization of humeral head and glenar cavity, the same.